Chapter 2, Lecture 2. What is medical care? In the previous section, we talked about why we need good health, and we used even utility theory to explain why we need good health and how to measure good health. We said that also that we can improve our health by investing in medical care. In this section, we talk about what is medical care. So if you want to define that, we say that medical care covers so many goods and services that maintain, improve, or restore a person's health. So we group them in two categories, two big categories, the medical care in two big categories of medical goods and medical services. Medical goods can be prescription drugs, wheelchair, denture, even surgical table or surgical bed. Basically very clear. Medical services can be surgeries or annual physical exams, a visit to physical therapists or your dentist or psychiatrist's office. So, for example, when your parents are going under hip replacement surgeries to, walk without pain, or when you're taking your children to the dental clinic for annual, basically checkup. These are all medical services. They are very actually different, and so we actually explain why it's difficult to quantify them and measure them and evaluate them. What is medical care? Units of medical care are difficult to measure because, first of all, they are very heterogeneous in nature. So, heart surgery, it's very, very different than dental clinic or physical therapy or psychiatry services. So, how you wanted to quantify heart surgery with physical therapy services? And how do you want it to add them up? These two services, they're very heterogeneous. So the unit of medical care are difficult to measure precisely. So we in health economics, we say that there are 4 I's of medical care that makes them difficult to quantify and measure. So these 4 I's are intangibility, inseparability, inventory, and inconsistency. So we go over basically explaining about these 4 I's one by one. So starting with intangibility. So that's the first characteristics. Intangibility means that a medical service is incapable of being assessed by the 5 senses that we are used to assess when we are actually using our money to buy a good or services. When you are going to a restaurant, easily you can evaluate a good food by the taste of the food from a bad food, bad taste food. So this is easy to evaluate, and then also when you are listening to your favorite song, favorite singer's song in CD, again you're using one of your 5 senses to enjoy and then to basically evaluate. Um, so for medical services, it's very difficult. You can't use really the five senses, at least not at the beginning. If you go under heart surgery, you have more pain than basically enjoyment, at least at the beginning. So, so that's one thing. And then the second one is inseparability. Inseparability means that the production and consumption of a medical service take place simultaneously at the same time. So, in fact, for example, a patient often acts as a both producer and consumer. Why? Because you know when you actually go to the physician's office, you have to cooperate with your physician and with your dentist in the process of production and consumption. So like if your physician asks you to basically raise your hand, open your mouth, you have to cooperate, otherwise the production doesn't take place. So that actually means why we are talking the inseparability between consumption and production. If the patient doesn't cooperate, the production doesn't take place and the consumption doesn't take place, and um, so the patient should cooperate to the production to take place. Now, this third one, the third I is inventory. Inventory is directly related to the inseparability because the production and consumption of a medical service occurs simultaneously. Healthcare providers are unable to stockpile or maintain an inventory of medical services. So, what does it mean? It means that, for example, a dentist cannot um, basically produce that dental care and then put it in the storage, and then whenever you need a dental service to go on, basically use it, consume it. So the production and consumption take place at the same time, and when patient need it. Um, so finally, inconsistency means that the composition and quality of medical services consumed um, vary widely across medical events. What does it mean? It means that although everyone visits a physician at some time or another, um, basically each visit is for different reason. When I go to my, basically um, family doctor, I may actually have concern about my high cholesterol versus uh, my brother may actually go um, concerning, for example, because of the um, having pain um, in the like back pain. So basically, there is an inconsistency in the composition and quality of the medical services, which makes difficult to quantify and measure them all together. So let's see. So again, we wanted to see then what we have to do here. So um, when we wanted to quantify them, assess them, measure them. Um, the other problem is the quality of medical care is difficult to measure, and that's because of the structure, process, and outcomes of the medical care events. So there are three actually factors here: structural quality, um, and then process quality and outcomes quality. So what is the structure quality here? Structural quality is related to the physical and human resources of the medical care provider. Um, for example, the basically the facility level of the for example, amenities or medical equipment, the type and age of the equipment. For example, this machine, when you go to the dentist, one dentist may have a more updated machine compared to the other dentist. And the personnel, the dentist assistant may actually um, have different training and experience, and in different doctor's office, which actually affects the quality of the service. So this is called a structural quality. And also administration is very important. It's basically is the organization structure. It's related to the delivery of system even before people see their doctors. So that actually affect the quality of the service. How this administration is organizing, basically to see the doctor before even seeing the doctor. So these are the delivery of system. It's very important um, in health economics for cost effectiveness of the medical care. Um, so the second factor is the called process quality, which which is actually the process quality reflects the a specific action healthcare provider take on behalf of the patient in delivering and following basically with the medical care. So basically even again this is through the um, it's related to the waiting time. It's very important, the waiting time for the quality of the medical care, um, but um, or data collection. How um, the doctor or nurses or the administrative personnel, they're collecting the background history and testing, and whether the physician or the nurses, the staff, they are communicating with the patient um, in the effective way. So they actually understand the concerns of the patient, whether the diagnosis and treatment, the type and appropriateness of these diagnosis and treatments, they're very important. So how you want to compare these process quality of one, say this in a dentist office compared to the psychiatrist's office, and then it's very difficult to uh, compare and quantify basically. And then um, the last one, the outcome quality, is more straightforward than the other two, the structural quality and the process quality. For the outcome quality, so we are looking at the final outcomes. That would be it refers to the impact of care on patients' health and welfare. Um, so of course, if you wanted to evaluate by patient satisfaction, then that would be more subjective, by person, you know, if compared to when it's like you are using objective quality measure. So if you wanted to, uh, for example, for outcome quality, if you wanted to use the work time lost to disability, this is more objective. This is more straightforward. Or For example, post-care mortality rate. This is very easy to compare, to quantify, like number of the mortality rate or work time loss to disability. These are easier than compare when you you're caring about the patient's satisfaction, which is more subjective. Um, so then some of the outcomes measure, as we said, they're subjective, and sometimes maybe they're objective, because it's extremely difficult to keep all these three aspects of quality constant for every medical event. So therefore, the quality of medical services, unlike the physical goods, they're very difficult, inconsistent, difficult to measure and quantify, basically. So as you can see, medical care services are extremely difficult to quantify compared to the medical goods, right? So what we are going to do then? What are the basically solutions here? The solutions in health economics, when we are talking about, there are two ways basically to quantify major medical care services. One is by availability, and the second is by utilization of the medical services. So, for example, when we wanted to say that comparing the medical care in Maryland compared to Virginia, we ask two questions. We say that the availability and utilization of the medical care for example, in these two states. Generally for medical care is measured on availability basis. For example, measures include the number of physicians or hospital beds. So these are very general two basically parameters: hospital beds and physicians, number of the physicians, two very important key parameters per 1,000 people. You can actually say that, what is the availability of the medical care in Maryland compared to Virginia or Pennsylvania or any other places, or even cross-country comparison. The second one is utilization of medical care. How often a medical service is actually delivered. So if medical care is measured in terms of use, the analysts usually employ data indicating how often a medical service actually delivered. So delivery is very important. And how do we measure that? For example, the quantity of the physician visit or surgeries per capita is often used to represent the amount of physician services, or the number of the inpatient days. Usually, if we use to measure the amount of hospital or nursing home services consumed. So these two parameters, availability and utilization of the medical care, are two parameters that usually we use to quantify and measure medical care in different services. And because of these four I's, you can see that the measurement and outcomes are different in medical services. And because of these four I's, we use these two main parameters, key parameters, availability and utilization of medical services, to quantify medical services. This is part 2 of chapter 2. Let's go to the part 3.